Colon cancer is not a genetic disease. Did you know that your diet can cause colon cancer? Knowing this information can save many lives. Today I'm going to talk about the early symptoms of colon cancer. Bowel cancer is a very important subject these days because it's something that's on the rise, and the cases of bowel cancer have increased significantly in the last few years, and it's something that could continue to increase in the same way if nothing is done about it, because most people still believe that bowel cancer is just related to our genetics, that it's something that we inherited from our family, that my ancestors had it, that there's some abnormality in my genes, in my DNA. Most people believe that cancer has nothing to do with lifestyle, nothing to do with diet. As scientists continue to investigate and try to understand and find the primary cause of bowel cancer, they began to see that there are actually many factors that occurred during the life of the individual who had bowel cancer, and there are measures that we can take before bowel cancer develops in our body. There are also some signs and symptoms that we need to be aware of in order to know when to seek medical help. Let me ask you a question. How many cancers do you think are linked to our genes? What percentage of cancers in the world do you think have a genetic factor? Write in the comments what percentage of cancers in the world do you think are genetic. Because my mother had cancer, I'm going to get it. Because my father had cancer, I'm going to get it. Because my uncle had cancer, I'm going to get it. Write down for me what percentage you think is genetic. I'll give you the answer, and you can compare it to yours. Did you know that only 5% of cancers in the world are related to genetics? The rest of the cancers are totally related to the way we live our lives, our diet, our stress, and our quality of life. So to protect our gut, we need to know our gut. And today we're going to remind you a little bit about the functions of our intestines before we look at the 6 main symptoms of colon cancer. The large intestine, also known as the colon, is the last part of the gastrointestinal tract. It extends throughout the abdominal and pelvic cavities and is about 5 ft long. That's almost the height of an adult human being. It's almost my height. I'm 5'2". Most people think that the large intestine, the one in the picture here, is the same as the small intestine, and many people also think that it is necessary for absorbing nutrients, but it is not. The large intestine has 3 specific functions that we can highlight. The first function is excretion. The second function of the large intestine is rehydration, which means that everything that we drink, everything that we swallow, from tears to saliva, goes through the production of mucus in the mouth, in the esophagus, in the intestines. In other words, all the liquids that come and go and drain through the gastrointestinal tract will reach the intestines. Most of this water, these liquids, need to be reabsorbed back into the circulation to avoid dehydration of our body. Most of this liquid needs to be reabsorbed back into the circulation so that we can start the whole process again and make the feces drier so that it can be excreted. The third function of the intestine has to do with our microbiota. Now that you have understood a little bit about the 3 functions of the large intestine, the colon, let's get to the facts about colon cancer, which is the purpose of today's video. When we look at the cases of colon cancer, the whole community is realizing that they are increasing dramatically, and the diagnosis is very late. We see that colon cancer rates are increasing all over the world. I compare this type of cancer to a burglar who comes to your house in the middle of the night and takes you by surprise, and you don't have any idea what's going to happen. In the treatment of colorectal cancer, the problem is that most of the time when we are diagnosed with colon cancer, it's already too late, because we don't know the first symptoms of colon cancer. That's why I decided to make this video in a very didactic, practical and simple way, so that if you have any of these symptoms, please seek medical help. Let me ask you a few quick questions. Have you noticed any changes in your bowel movements? 1 hour you are constipated, the next day you have diarrhea, the next day you are constipated again. Have you notice blood in your stool, or a change in the color of your stool? It doesn't have to be bright blood, but is there a change in the color of your stool? Have you been tested recently and found to be anemic? Do you always have pain in your stomach when you go to the pharmacy to buy Buscopan, paracetamol and Diron? Pay attention now, because I'm going to explain how each of these symptoms can be a sign that your gut is sick. I'm going to list the 6 main symptoms of colon cancer. Symptom number 1 is any abnormality that appears in your stool, different changes in your bowel habits. Sometimes you have severe diarrhea, other times you're constipated, you can't evacuate, you have to take a laxative. It's this alternation between diarrhea and constipation that could have an important cause, and you should see a doctor. There may be some internal abnormality in your intestines. You need to see a doctor. Have you noticed a blood in your stool? Symptom of colon cancer number 2, if there's blood in your stool, you may have hemorrhoids. Fine, go to the doctor, get your hemorrhoid treated. Check if it really is a hemorrhoid. However, blood in the stool can also be caused by a tumor that causes internal bleeding. resulting in blood in the stool. It is never normal for blood to appear in your stool or for your tool to have a blood-like color. Symptom number 3. Are you anemic? Have you had a blood test recently and found that you are anemic? This could indicate bleeding in your intestines. It could indicate blood loss due to bleeding in your intestines. Have a blood test and complete blood count to see if you are anemic. The presence of anemia indicates that you have an insufficient production of red blood cells and a high consumption or excessive loss of them in any part of your body. Therefore, you may not be producing enough red blood cells. If this is the case, see your doctor for a proper diagnosis. If you have intestinal bleeding and you didn't notice it when you looked at your stools, it's possible that the blood has mixed with the stool and you may think that the stool has just become dark, but it's important to know that this can indicate blood loss, and that's why you have anemia. So you could be losing blood through your intestines and not even know it. Do you have chronic stomach pain? Do you always have pain in your stomach? This could be a symptom of colon cancer. Number 4, if you always have abdominal pain, if you always take a cetalopen, if you always have this pain, or if it's chronic on a daily basis, or if you have spikes of pain, this sharp pain that appears from time to time that feels like a needle being stuck in your intestines. If you have a lot of pain, it's important to see a doctor to find out the cause of this pain in your intestines, because that's not normal either. This can be an early symptom of colon cancer. Many people come into the pharmacy and ask me, oh, I need some medicine for pain in my stomach. Then I ask, but have you had a little pain, a lot of pain, that sharp pain? Oh, I have it from time to time, 2 or 3 times a week. I take Buscopan, acetaminophen, even Mioli. And sometimes I have diarrhea, sometimes I haven't been to the bathroom for 4 or 5 days. I take a laxative. Could it be gastritis? Could it be that my bowels are clogged when these symptoms come and go? Your body is screaming, it's sending you a signal, a warning that your bowel is sick. I like to compare it to colon cancer. It's like a train, it keeps whistling, it keeps whistling, it keeps giving our body signals that it's coming. It gives us frequent stomach pains, blood in the stool, anemia. But if we ignore these symptoms and then the train stops in front of us, we already have a serious problem. It's not normal to go 4 or 5 days without going to the bathroom, without pooping. It's not normal to have diarrhea 1 day, 4 or 5 days without going to the bathroom. Diarrhea again. It's not normal to have frequent stomach pains. Look at the warnings body is giving you. See a doctor to diagnose what's going on in your gut. Symptom number 5 of colon cancer. Have you lost a lot of weight lately? Do you lose weight out of the blue? Are you not doing anything to lose the weight? Colon cancer is one of the cancers that can cause people to lose weight without any effort. There are several types of cancer that cause weight loss, and colon cancer is one of them. So if you're losing weight, you're not doing anything to lose weight. You haven't changed your diet, you haven't changed your lifestyle, especially if you've lost more than 10% of your body weight in 1 month. Please go to the doctor immediately for a proper evaluation. Do you vomit constantly? Do you always feel sick to your stomach? Do you have chronic vomiting? This is colon cancer. Symptom number 6. If you're constantly vomiting, it may not be your stomach. There may be something going on in your intestines, because our intestines are connected through the vagus nerve. So some abnormalities in our intestines will affect our stomach, causing us to have stomach problems. Even though the symptoms are manifesting in the stomach, the problem could be related to your intestines. So I urge you, if you are vomiting repeatedly and there is no obvious cause for it, you haven't eaten anything that would harm you, please see your doctor to determine the best way to diagnose the situation and see if you have a problem with your intestines. But how is colon cancer diagnosed? The best way to make a diagnosis is for your doctor to order a colonoscopy and biopsy. All colorectal cancers start as growths called polyps in the bowel. Not all polyps are cancerous, but all colorectal cancers develop from a polyp. During a colonoscopy, the doctor will look inside the colon and check for polyps. He or she will then take a biopsy of the polyp and send it to a pathologist for microscopic analysis. This can help determine the type of polyp, whether it is infectious or inflammatory, and whether there are signs of early stage colon cancer. In the majority of cases, if only one polyp is found and removed and cancer is found in it, the cure is virtually 100%. And there are no further problems. However, if you have a family history of colon cancer, don't eat a healthy diet, are over 35 or 40 years old, have 4 or 5 of the symptoms I mentioned in the video, go to your doctor and ask for a colonoscopy. A colonoscopy should be done every 5 years, starting at age 50. But if you have aggravating factors, it can be done every 3 years. Find a doctor who specializes in gastroenterology. This is the most important recommendation. Again, it's important to remember that the best thing for colon cancer is prevention and early detection. The signs I talked about in the video are extremely important. If you have any of these symptoms, please see your doctor and ask him or her to do a colonoscopy or biopsy. In this way, we can encourage positive changes in our healthcare system. Did you like the video? Click the like button, subscribe to the channel so you don't miss out on our health tips, and ring the bell. It's very important that you share this knowledge with your friends and family, because when it comes to your health, it's worth sharing, so please do so. What's the next video you're going to watch? I'll leave you with my recommendation. Until the next video, thank you. And still the next video, thank you, and stay healthy.